Low-carb diet may aid your metabolism. Eating low-carbohydrate meals may lead to healthy changes in a woman's metabolism that don't occur when consuming higher carbohydrate meals, a small study suggests. The researchers also found that the timing of exercise may play a role in how beneficial it is for your metabolism. The study's senior author, Katarina Borer, said the study illustrates that small changes can make a difference, such as watching the kinds of foods you eat and not exercising at an inappropriate time. It's an empowering message, said Borer, a professor at the University of Michigan's School of Kinesiology. The study reported that when people ate 3 meals containing just 30% carbohydrates over a 24-hour period, they had a 30% reduction in their after-meal insulin resistance and insulin levels. Insulin is a hormone that helps the body use carbohydrates from food to fuel the cells in the body and brain. People who are resistant to insulin have a higher risk of prediabetes and type 2 diabetes. When people ate 3 meals containing 60% carbohydrates over 24 hours, there was no such reduction in insulin resistance or insulin levels. The study included 32 healthy postmenopausal women, ages 50 to 65. None had signs of diabetes or prediabetes. The women were placed into one of 4 groups: high or low-carb diet, and with or without exercise before meals. The women had a meal at the lab the night before the study, and 2 study meals the next day, one in the morning and the other at 5 p.m. Each meal contained about 800 calories, Borer said. The low-carb meal was 30% carbohydrate, 25% protein, and 45% fat. But, she said, the researchers focused on good fats such as olive oil. The meals included items such as macaroni and cheese, sausage, and ham, chef's salad, fruit, a veggie burger and soup. The higher carbohydrate meal was 60% carbs, 15% protein, and 25% fat. This diet fell in line with national dietary guidelines, according to Borer. These meals included egg salad on a multi-grain bun, bacon, ham, and cheese sandwich, carrot sticks, bananas, coleslaw, orange juice, skim milk, graham crackers, pretzels and vanilla ice cream. The exercise groups were moderately active for 2 hours, and the exercise session ended 1 hour before a meal. Normally, exercise is thought to help reduce insulin resistance and lower blood sugar levels. But in this study, exercising before eating actually raised women's evening blood sugar levels, the researchers said. During exercise, you need energy, triggering hormones that promote the release of sugar from the liver. Most of the body's tissues become insulin resistant to allow the brain and muscles to use that excess sugar, Borer explained. If the tissues don't use all that sugar for the workout, blood sugar will remain elevated, she added. If you exercise after eating, however, your meal provides the fuel instead of your liver, Borer noted, and the excess sugar from your meal is likely used up. She recommended exercising within 40 minutes of eating. Borer acknowledged that the results from this study were only short-term. She also noted that she couldn't comment on how this low-carb diet and pre-meal exercise might affect someone with prediabetes or type 2 diabetes because she only tested healthy women. Most Americans could easily decrease their intake of carbohydrates from foods such as fast food, junk food, sugar-sweetened soda, and desserts, said registered dietitian and exercise physiologist Samantha Heller. She's a senior clinical nutritionist at NYU Langone Medical Center in New York City. People need to get some balance in portion size management. I encourage a healthy protein with each meal or snack, like nut butters, eggs, lean meats, said Heller, who wasn't involved with the study. Adding protein to a meal or snack helps keep blood sugar levels more stable and leaves you feeling fuller longer, she explained. Heller added that exercise should never be discouraged. Generally, she said, it's probably fine to exercise on an empty stomach. For most people, the best time to exercise is when you're actually going to do it, she said. Everyone should drink fluids, she recommended. And if you're going to work out hard, you might need some food. But that depends on when you last ate, she said. Findings from the study were published recently in the journal PLOS One. Home remedies for UTI. Urinary tract infections are some of the most frequent clinical bacterial infections in women, accounting for nearly 25% of all infections. More than 50% of women will develop a UTI and UTI symptoms in their lifetimes, and because antibiotics are the most common conventional treatment for UTIs, bacteria have become antibiotic resistant and recurring infections are a major concern. For this reason, it's important to use home remedies for UTIs that eliminate bacteria completely and reduce the risk of developing recurrent urinary tract infections. Some of the best home remedies for UTI include drinking plenty of fluids, staying clean and dry, and consuming things like cranberries, probiotics, vitamin C, and using essential oils. Keep watching for all 12 of my top home remedies for UTI. 12 home remedies for UTI. 1. Drink plenty of fluids. Drinking water or fluids throughout the day helps flush bacteria from your system. A 2013 study conducted at the University of Texas Southwestern Medical Center at Dallas found that chronic low fluid intake may be an important factor in the pathogenesis of urinary tract infections, just one of many reasons to stay hydrated. Drink at least 1 glass of water for every meal and snack of the day in order to flush out bacteria that can lead to infection. 2. Urinate often. Urinating often and when the urge arises ensures that bacteria isn't growing in urine that stays in the bladder. It's also important to urinate soon after sexual intercourse in order to flush out bacteria that may have entered the urethra. Studies have found that holding urine for a long time allows bacteria to multiply within the urinary tract, resulting in a urinary tract infection. 3. Stay clean and dry. Women should wipe from front to back, especially after a bowel movement. This ensures that bacteria doesn't get into the urethra. It's also important to wear loose-fitting clothes and underwear, which allows air to keep the urethra dry. Wearing tight jeans or material like nylon can be problematic because moisture can be trapped, allowing bacteria to grow. 4. Avoid using spermicides. Spermicides can increase irritation and allow bacteria to grow. Using unlubricated condoms can also cause irritation, so choose lubricated condoms that don't contain spermicides. A 1996 prospective study published in the New England Journal of Medicine indicates that among sexually active young women, the incidence of UTI is high and the risk is strongly and independently associated with recent sexual intercourse, along with recent use of a diaphragm with spermicide. 5. Probiotics. Because of the development of bacterial resistance, one of the most promising home remedies for UTI, especially recurring UTIs, is probiotics. Research published in the Indian Journal of Urology explains that benign bacterial flora is crucial for preventing the overgrowth of microorganisms that lead to illness. The use of antibiotics destroys beneficial bacterial flora, and pathogenic bacteria are selectively enabled to overgrow on internal and external surfaces. Probiotics help support the human body's normal flora that serve as a line of defense. Eating fermented foods also helps restore the body's natural flora and recolonize the bladder with helpful bacteria. Some of the healthiest fermented foods include kefir, kimchi, probiotic yogurt, raw cheese, sauerkraut, and kombucha. 6. Cranberry. Some studies suggest that cranberry juice may decrease the number of UTIs a person develops over a 12-month period, particularly for women with recurrent UTIs. Although there's limited or mixed evidence concerning cranberry's ability to manage UTI symptoms, there is evidence that cranberries can be used as a preventive strategy. Animal studies show that cranberry products appear to work by inhibiting the growth and colonization of bacteria that cause infection, including E. coli, the most common bacteria seen in urinary tract infections. 7. Garlic. Allicin, one of the active principles of freshly crushed raw garlic, has a variety of antimicrobial activities. In its pure form, allicin has been found to exhibit antibacterial activity against a wide range of bacteria, including multi-drug-resistant strains of E. coli. Garlic also has antifungal properties, particularly against Candida albicans, which causes yeast infections. 8. D-mannose. D-mannose is a kind of sugar that's related to glucose. It's on this list of home remedies for UTI because it can prevent certain bacteria from sticking to the walls of the urinary tract. A 2014 study published in the World Journal of Urology tested whether D-mannose powder is effective for recurrent urinary tract infection prevention. In the study, 308 women with a history of recurrent UTIs were divided into 3 groups. One that received D-mannose powder in water for 6 months. The second received nitrofurantoin, an antibiotic, daily, and the third did not receive treatment. Overall, 98 patients had recurrent UTIs, 15 in the D-mannose group, 21 in the nitrofurantoin group, and 62 in the group that received no treatment. D-mannose powder significantly reduced the risk of recurrent UTIs, and patients in the D-mannose group had a significantly lower risk of side effects compared to patients in the nitrofurantoin group. 9. Vitamin C. Vitamin C makes urine more acidic, inhibits the growth of E. coli, and enhances immune function. A 2007 study evaluated the role that daily intake of 100 milligrams of vitamin C plays in urinary infection treatment during pregnancy. Researchers found that vitamin C treatment for a 3-month period was able to reduce urinary infections, improving the health level of the gestating women. 10. Clove oil. Research published in Phytotherapy Research indicates that clove oil has antimicrobial, antifungal, and antiviral activity. Another clove oil benefit is that it possesses anti-inflammatory properties, and it's used to relieve pain and promote healing. Clove can be taken internally for 2 weeks at a time, but I recommend that you do it under the care of a healthcare provider or nutritionist. 11. Myrrh oil. Several human and animal studies show that myrrh oil has antibacterial, antifungal, and antiparasitic properties. Historically, it's been used to treat wounds and prevent infections. It can be applied topically with a warm or cool compress, or rubbed into the skin. Use caution when using myrrh internally. Make sure to use a pure, high-quality product and do it under the care of your healthcare provider. 12. Oregano oil. A 2012 study evaluated the antibacterial activity of oregano oil. Researchers found that oregano was active against all of the clinical strains of bacteria that were tested, and it successfully inhibited the growth of E. coli, the bacteria most commonly seen in UTIs. Researchers believe that oregano essential oil can be used as an alternative antibacterial remedy for enhancing the healing process in bacterial infections, and it's an effective means for the prevention of antibiotic-resistant strain development. In fact, oregano oil benefits may be superior to prescription antibiotics because oregano doesn't cause antibiotic resistance and it has no harmful side effects. When taking oregano oil internally, mix it with water or coconut oil. I don't recommend taking oregano oil for more than 2 weeks at a time, and it should be administered under the guidance of your healthcare provider. Precautions regarding UTIs and home remedies for UTI. Although these home remedies for UTIs have been studied and proven to be effective, it's important to use these natural treatments with the guidance of a healthcare provider. Uncomplicated UTIs should be treated within 2 to 3 days. If the symptoms do not subside within that time period, see your healthcare provider to be sure there aren't complications.